my phone on.
We're already live.
Disturb. Hey y'all, hey.
Hey, good
Hi.
evening, ladies. How are you doing?
I am doing great. I'm glad to
Nice.
see you
So
guys. Just
welcome back,
putting
and
my phone
welcome, Dr.
Fabulous.
Chanel.
I'm
Thank
so glad to
you.
be back.
I was so excited. I brought you guys on screen right away because tonight's topic is hot, hot. A lot of people are excited about it. And we absolutely love talking sexual health because we don't talk about that enough. And Crystal can tell you it's not her first time here. She was on here with Dr. Travis before.
Yes,
So thank you for always saying yes.
of course. I love you guys. I
Yes.
want to keep everybody sexually healthy.
Yes. So, welcome everybody. Good evening. Welcome back to our podcast. Um, Tonight's episode is about World AIDS Day, which happened on Monday, which was on Monday. So, we are here to talk all things STDs. Real talk, no shame, no fluff. I'm sitting here with Dr. Chanel and Crystal, who is also a AIDS certified nurse. So they're gonna give us all the do's and don'ts and everything we need to be aware of. So we're talking real sex, real safety tonight. AIDS Awareness Week special episode. Um, so we're gonna clear the myths. We're gonna drop the shame. We're going to talk condoms, testing, desire, and the things your partners might be too shy to ask.
Right.
So, um, sexual health and self love, awareness, protection, knowledge, liberation, all of it. So, welcome, welcome. You guys can join in. I will post in the link. I'm not sure. Somebody has an echo.
I wonder if it's me. Let me know if it's better when I go on mute.
Do you have two screens? Yeah, I think it's you.
Because, I see two screens open, but I don't hear an echo on my end. I don't know how to close out the other screen.
Okay, now it's fine.
Oh, okay, cool. I guess I said it.
Yeah. So, yeah, I'm not sure what I did to this thing. So apparently it's showing a bunch of faces, but it's okay because
Right.
we are beautiful people in here so the
Exactly.
people can see us bubble
We're
and
all
remember us
moisturized.
tonight.
Praise be. Praise be. Let me make sure I'm moisturized.
Okay, for real.
Yes, yes. So without, let me see. Oh, okay. Give me 1 second. I think it's telling me to do something. Oh, hold on. Sorry.
That was fine.
Hmm.
Okay, that was saying you're in the show. Little
Yeah.
technical difficulties. It's all good.
Yes. Every once in a while it'll test me. I'm not a
Exactly.
tech person.
We're doing God's work. That's why it's trying to take us
Exactly.
It
down,
wants
honey.
to
That's
make
how it
sure,
is.
it keeps you on your toes,
Exactly.
Yes.
Exactly.
You know what? Let me see if it's me. Because I feel like I still hear.
A little echo, yes.
Yeah.
I don't hear it.
Okay.
It's
Can
very
you?
faint.
Okay. All right. So, I think it might be me because of my mic. Um, so we're gonna introduce ourselves to the audience, and we'll take it from there. For those who don't know me, my name is Me Too. I am the Haitian Hottie, and I also, I love to talk everything relationships, non-monogamy, sex, sexual health, all of it. So we are here, and thank you for being here with us. I don't know who wants to go next.
God, Chanel.
Oh, wow.
Yeah.
So my name is Chanel Grant. I am a doctoral prepared family nurse practitioner, board certified family nurse practitioner, and HIV specialist. I am one of the co-founders of Simple Healthcare, which is a primary care facility or practice that operates in New York State for now, with a higher focus on sexual health. And I am also a full-time educator at Hofstra University.
All right. Thank you, Dr. Chanel.
Alrighty, how are you guys? I am back.
Yes.
Crystal Masanya is my first name, but I always give people two names because some people do not know how to say Masanya. I've been practicing with nursing for 16 years, and I started off in psych. And one day I was just looking for a job to find something new and ended up at a sexual health clinic. And upon my leaving that clinic, I decided to get my AIDS certified registry done. So now I'm an AIDS certified RN. And truthfully, I enjoy it. I love the juice. I love the drama that walks through the doors of the clinics. I love to hear people's stories. I love to hear, my favorite stories, though, are the ones of the people who contracted the virus back in the 80s that are still alive to tell the story. And the stories are beautiful. You'll literally cry when you hear some of the stories. So I'd like to
I
share
can't
some of that with you guys tonight. And I say, let's get started.
Yes, yes. So let's talk about where we are today, medically, socially, and personally. Um, what we think we know versus what it actually is. So, what do most people misunderstand about HIV in 2025, HIV and AIDS?
I think one of the big misconceptions that I hear on my end, and Masania, you're more than welcome to chime in and let me know what you think, is that it is an infection that predominantly affects men who have sex with men. There's still this premonition that only men who have sex with
Yes.
men
Yes.
get HIV. Everybody else is safe.
Yes.
Allegedly, it's only men who have sex with. That's a lie. I'm here to tell you the lie detector determined that's a lie.
Right.
Yeah, thank you for letting them know because I think some people, because honestly, I think as early as this year, I was talking to somebody and I was talking about bisexual men with who I celebrate very much. And one person I was talking to was like, well, if they're bisexual, it's just easier to have STDs. And I'm like, how
Right.
so? Like,
Right.
oh, because and I'm just like, I don't
No.
know, because you're out here swinging it everywhere and putting it in every hole and everything, but you're not worried about yourself, but you're worried about this person that might not even be doing anything just because he claims to be bisexual.
Right.
All of a sudden, he has to have that sticker on him. So I definitely believe that people think it's men who are having sex with men that can
Definitely.
only catch HIV or any STD in general.
And I think also a lot of times people feel like they can get the virus by maybe eating off of the fork of someone else, kissing, just basic things like, oh, I can't hug anyone because they might have HIV or AIDS. And
Yeah.
Yeah.
it's a little bit irritating, but that's what we're here for, to, educate the masses.
Yeah.
Get them
So
to
basically
have some fun.
you can't really catch it from sitting on the toilet seat in
Right.
the public bathroom.
Right.
No. It's an old myth.
It's a
Not
very
kissing, not like hugging somebody who
No.
has it. Oh wow.
Not sharing forks or sharing
No.
plates. No. It's an
And
old
I think
myth.
a lot of people are going to be so disappointed tonight.
No. They're stuck in the past. They're in
they
as the
are.
kids and the young folks would say, they're in the 1900s.
They are.
Exactly.
Not a
Yeah.
thing.
Hey Manushka. Hey R2186. I can't really tell who it is, but we're just gonna say hi.
Yeah.
So yes, let's continue. How have treatment and prevention evolved, and what do people still not realize?
You're not gonna. Okay, great.
Oh, I was waiting for you.
I was ready
I
for
was
you
going to go
too.
straight to the
Okay.
injections, but go
I
ahead.
think that one of the big things, right? So outside of the misconception that HIV only affects men who have sex with men, I think a lot of people, cisgendered persons, don't realize that there is HIV prevention mechanisms that are like over 99% protective in preventing individuals from becoming HIV positive, even if they're exposed to it. Like that's huge.
Right.
And I think that people also, the second part of this that I think people don't realize is that people in this day and age, 2025, are living long, beautiful, healthy lives with HIV. We
Yeah.
have come so far in terms of treatment and medication that people are living beautiful, like beautiful lives into
Right.
their 80s, 90s, having a fabulous time, and they're
Yep.
HIV positive.
Yep.
Yeah. You said something earlier. I'm not sure if everybody in the audience will understand that word. You said cishet. Can you explain for the audience what cishet is?
So, cisgender persons are
Mhm.
what we used to call heterosexual people. You know,
Mhm.
people who identify as women, who are born as biological women, are cisgendered women, and persons who identify as males and are born with, biologically a male are cisgendered males.
All
Right.
right. Thank you so much, doctor. We just want to make sure every time
Yeah.
Yes,
we
Yep.
because it's a newer and a lot of people are still not aware of those terms. So
Right.
yeah. And
So
Masanja, you want to
yes, I
add
got you
something to
guys.
that?
Of course, of course. So the beautiful thing that happened to me when I got into infectious diseases and sexual health was that's when we transitioned from pills to injections. So when I got into this clinic life, I was like, oh my God, there's injections for this stuff now? I
hmm
had no clue. Like I grew up in the 80s, so I grew up knowing of the 26 pill combo that people had to take every single day or they were gonna die. So I was just impressed by the fact that science had reached a point where we're at one pill. I'm like,
Yep,
one pill? This is a
one pill.
miracle. This is the perfect time for me to start working here. And then I
That's for
started working
somebody
there.
who's already infected.
Yeah, for someone who's
Oh
already
wow.
infected. So they went from 26 pills to like 13 pills to eventually five and down to one. One single pill, which is awesome to me. And now there's the injections,
Come
which
on,
is
give it to us, AIDS certified
um,
RN. Give it to
okay.
us. Give it to
The
the people.
injections blew my mind. I'll never forget my first time drawing up those injections, knowing that this was going to save people's lives. And because I was the nurse manager at the time, it was my job to really. I have a very unruly cat that likes the camera. I'm sorry.
It's
She does not
okay.
stop. Anytime the camera's on, she decides that she's going to do this. So basically, I was so impressed with the fact that I can give injections, and I was personally monitoring all of the blood work, watching everyone's viral loads, watching their CD4s, and literally seeing the actual science play out. That, oh crap, this stuff actually works.
hmm
It actually works. So I'm grateful for those injections for my patients. And then, even better, with PrEP, you get injections and pills as well. So I'm like, hello, win win. Everybody gets to live. No
Yep,
one ever has to get HIV ever again if they
correct.
choose not to. I
Yeah.
love it.
Yeah,
Yep.
I love that. And it's good to know that there's only one pill now because yeah, like you
Yeah.
said, that when we went through the phase of not knowing what it is and to okay, maybe we can treat it now, but you have to take a bunch of pills every day and then now to one pill, now to injection. And I have to say to my audience as well, it's because of you, Masania,
Oh, really?
were
What?
here the last couple of times and talked about HIV and all of that stuff, then talked about PrEP. I didn't know anything about PrEP. So
Right.
I started talking to you more about it. And then
Yeah.
you encouraged me, you pointed me in the right
I'm
direction.
so
I am
glad.
happy to say I took the pills for like 1 year and I just got my first injection last month. And I'm so
I'm
excited.
so happy
Yes.
for you. Yes.
I'm
So
That's
happy for
awesome.
you.
yes, I'm very happy about it.
That's so
I
cool.
I was very excited because it took a while for them to approve the
Yeah,
injection.
it does take a
And
while.
yes, and I even though
Mhm.
they do make it, they still make it very easy to get
Mhm.
the pills. 'Cause when you get the pills, they actually send it to where they label each day and date for me. So if I miss a dose, I already know which day it is. So I don't have to think about it. I can just go back to my box
Right.
real quick and see what I missed. But now I don't even have to think about it. I got my
Exactly.
first injection. I am going actually next week for my second one.
Good.
And
That's
I
good.
think after that one, it's every 2 months,
Yes.
something like that.
Yes.
But so the only thing that happened after I got the injection with a little bit of soreness on the
Yeah,
spot. So I got to
that's typical. That's typical.
Common,
I,
common,
I
common,
always
a
tell
common
folks
effect.
yes.
exactly. Yeah,
So
it's
I
gonna
was
feel like leg day at the gym. That's what I
Yeah,
yes.
always tell
yeah, yeah.
people. Yep.
I was terrified when I was going for the injection because I am afraid of needles, and people always look at me like, "But you have a bunch of tattoos." I'm like, "Not the same at all."
It's
And
true.
when I
That's what you guys always say. And it just,
It's
I don't,
true.
it's true.
It's not the
I'm always
same.
like, how?
That IM needle goes so deep into the muscle. The tattoo is like this little itty bitty thing that's on
right,
the surface.
yes. So the whole time she's like, "Are you okay?" I'm like, "I'm nervous. I'm not gonna
Yeah.
hide that."
Yep.
She's like, so I was like, "Just don't let me see the needle."
Yes, you don't
Like,
want to.
okay. So then eventually after we talked quite a bit, I was like, actually, I want to see what's gonna
Yeah,
happen. So I want to see the needle. She lets me see it. I'm like, oh my God.
I
I
know.
know.
It's at least 2 inches. It's quite big.
It's pretty, yeah, yeah, yeah.
So I was like, okay. She's
Yep.
like, are you sure you still want to do it? I said, no, I'm here.
Yeah,
I mean, I may be a chicken, but I'm not that big of a chicken. So I'm
no
here.
problem.
I'm not gonna die. But we're gonna do this.
Exactly.
So finally, she's like, okay, are you ready? I said, okay, I don't want to see it. Just make it as fast as you can. And
Right.
then, she's doing her thing and she just asked me one question before I could even answer. She's like, we're done. I was like, are
Exactly.
Quick,
you serious?
That's
quick,
a good
I didn't even
nurse.
feel a thing. I
That
was
is
quick.
a good nurse.
so I was nervous for no reason. But I
Yeah.
have to say, the first day I was fine. The next day, that's when I started feeling a little bit of soreness. She told
Yes.
me to put hot compress and all that stuff,
Mhm.
ibuprofen. I didn't do any of that. But the third day, I was like, ouch. It felt like leg day for sure.
Yes. Yes.
But,
Definitely.
it lasted a
Stay
few
hydrated with it
but
too.
yeah,
Yeah.
it was fine, and I'm glad I did it. And I can't
Mhm.
wait to get the next one. It just gives me peace of mind. And
Exactly.
as much as I know that there are treatments out there for HIV and AIDS, I would
Right.
much rather not have to deal with that.
Right.
So it just gives me an extra peace of mind every day that I sleep. So,
Right. Right.
Yeah.
I love that. I'm so proud of you. You go,
I'm
girl.
so happy for you. And you
thank
don't have to
Yeah.
worry
you.
about like, did I take it? Did I miss a pill? Did I?
Exactly.
You don't have to worry about any of that.
Listen, because and another thing that encouraged me to do it too,
Mhm.
'cause we can say, oh, we wrap it up and we do this, we do that. But I remember after a sexual encounter one time, I realized the condom broke and
Mhm.
I freaked out.
Right.
And I did not have peace until I got tested
Right.
and retested. And it was fine. And it's not because I knew the person had anything. It's just all of a
Yeah.
sudden you freak out and you think of the worst. So now I'm like, at least I don't have to worry about that part anymore.
Nope. Nope.
So yeah.
That's
Um,
good to hear.
yeah, so I am very happy about that. So is HIV still considered a chronic and manageable disease?
Yes.
Yes, I agree that it is chronic. I feel like for me, just like witnessing my patients, I feel like it affects them more psychologically than anything. Honestly, their bodies are fine. My patients, they come in, they work out every day, they're so fit and stuff, and they have HIV. Their viral load is undetectable, and I'm like, it's their mind
Yeah.
that
Yeah.
really gets affected. And so it's a lot of counseling that comes with working in this field and really talking them down off the ledge and letting them know it's okay that they have this and we're here now, we're going to get through it. Yeah,
And
yeah,
I think it's usually the stigma as well, because all of a sudden, because you have HIV, now you are considered unclean. And
right.
so,
Hmm.
side note, every time I'm on a dating app and I see somebody say, you must be clean or I'm clean, I'm like, swipe left. Because
Right.
if you're still referring to it as such, I kind of
Dirty.
feel like,
Yeah.
where are we as far as maturity? I don't know if we're going to be aligned
Right.
in that
Right.
sense.
Yeah.
So I usually try to skip those people.
I agree. I try to urge people to be sex positive. So I mean, I've gotten lucky enough where because I work in sexual health, the people that I come into contact with often are people who are sex positive, or they're trying to learn more about sexual events or things that they are interested in. like last week, I found this young lady on the internet, and she was hosting sex parties, and I'm like, oh, I need to go speak to her to find out if they need testing, because hello, let me go
Yeah.
educate the people. You know what I mean? So I try to be around, I immerse myself around sex positivity. I speak to my children about sex positivity, that, hey, your friend might have herpes. It's not your business how they got it, but maybe let them know, hey, you got a little something on your lip. You might want to, a little
Mhm.
tip about Bear or something. You know what I mean? Like, I try to be around sex positivity people, because I want us all to, we all got here because of sex.
Right,
So I think it's a
exactly. But
very
we don't like
important thing.
Despite how people behave, you would swear
Right.
there was some kind of like immaculate conception, and we all
Yes, they
did.
swear. Like, your mama was not an angel, honey. Okay, mama was dipping it low, dropping
Okay,
it down
was
slow to
throwing it
get you here, throwing it
okay.
back. Okay, so
She may not have told you, but you got here because she was throwing
exactly,
it
you
back.
got it somehow.
Okay.
Okay, so it's so important that we can continue those behaviors and be safe with it. That's the
Yeah.
main thing.
Yes,
I say every day, people do not have to contract HIV.
exactly. But I think some people still get mad if their partner asks them when was the last time they got tested, and if they are willing to get tested before those two engage. So how often should sexually active adults be testing?
That is such a good question. If we go by what the literature says, at minimum, they say once a year. I do not tell my, at minimum, once a year. What I tell the peoples, the community, us, is that if you are having a good time, making your way downtown, walking fast, you should be checking, you should be going to get STI testing. And so if that's once a month, twice a month, once a week, every other, whatever works for you is what you should be doing. The main thing, that the takeaway really should be is, am I doing everything within my power to make sure I'm safe and healthy?
Right. Exactly.
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 Because once a year,
Yeah, it's just not enough.
That is
It's,
like crazy business right
that's
there.
the
That's
bare
one
minimum.
fact.
it's the bare minimum for
That's
real.
the bare minimum. And the sad part is, some people are not even doing it once a year.
Mm-mm.
No, I've heard people. Some people say they don't test, and I'm just like,
Yeah.
okay,
Yeah.
already then.
Like,
Uh,
we monitor our patients, our HIV and our PrEP patients. We monitor them every 3 months. But if they need to come in more than that, insurance is not going to deny that.
They're not.
Coming
right,
in because you might be at risk. And like I tell the patients, don't you worry about what's happening on the insurance side. That's what we have a billing department for. That's
Yep.
what you have nurse managers and nurses for, and practice managers for, and providers to know to put in certain codes to get it covered. So don't worry about that part. You got to come in 3 times a month. Bring yourself
So
in.
be it. So be
We
it.
got
Yep.
snacks, we got water and juice, and come on down. Let's take some blood.
I don't even think there is. I mean, you let me know. I have never came encounter with an insurance company that does not cover for
Right.
multiple STI testing. I have
Right.
never
I
had
haven't seen it
cover,
yet.
right? I have never had a cover testing not covered
Right.
because the insurance company thought, oh, you're here too many
Exactly.
times a month. Never.
Exactly.
Never a thing.
Never seen it. Never seen
Nope.
it. But I make sure I put the right codes in.
Right. That's what matters. You got to put the right
Okay.
codes in.
Exactly. Just in case insurance
Yeah.
wants to act up.
And so I had a panel. I went to a panel discussion on World AIDS Day. I had a panel discussion, myself on behalf of Simple Healthcare. And one of the things that I told the crowd, or the persons the audience, the community members, is, yes, it's supposed to be once a year, but you should be advocating for yourself.
Absolutely.
Technically, right, if we're going to technically speak, and if everything was great, like, it should be something that's like standard in your annual wellness physical. When you go to your primary care provider, you're like, I gotta go to get a checkup. It should be like automatic. But I can promise you, most of the time it's not. They're checking everything else besides that. And sometimes that stigma, or that they think it's a difficult conversation to have, to initiate, or sometimes people get offended. I've asked people who are who are married and in monogamous relationships, like, hey, you're here for your physical, let's do STI testing. Actually, what I say is, I'm going to do, your CBC, your cholesterol, your A1C, and we're going to do STI testing. And then they're like, what?
Yeah.
Why? I'm married. I don't need to.
It's a real
Like,
thing.
that's a standard of care. Like if you feel like everything's good, then let's just check. It's covered.
Exactly. Why
Exactly.
not?
Yeah.
Yeah.
So
And that,
ask.
yes, and that's another thing I come across the internet quite often.
Mhm.
Most of the time, it's women who come on there outraged because they slept with either their husband, their boyfriend, some guy that they're dating that gave them either HIV, herpes,
Mhm.
anything
Chlamydia.
else, right?
Yeah.
So they come on the internet screaming, and I'm not victim blaming or victim
Mhm.
shaming, but I'm like, baby, what did you do to
Right.
protect yourself? Now
Mhm.
you coming on here screaming at this person for what they did to you, but nowhere did I hear you take accountability for the
Right.
part that you didn't do.
You said the right word.
So I can't feel sympathy when you just want to, and I understand we all
Right.
want somebody to blame when
Yeah.
something like that happened, but I just would like, ideally, I would like to live in a world where talking about sex, talking about
Mhm.
STIs and all that stuff is perfectly okay. And even when you're infected with something nowadays, like we said, there's cure, there are treatments to help you with whatever you're going through. Yes, it's inconvenient, but
Mhm.
you will be fine. You know what I'm saying? So,
Exactly.
and I see it all the time, and it's usually from monogamous people, right?
Right.
Because they're not going to get tested because they don't want the other person questioning
Yeah.
their reason for testing.
Right.
But then they're not thinking like, well, maybe they maybe I know what I'm doing, but I don't know what you're doing.
Right.
Even if I saw you at the house 22 hours out of the day,
Right.
I'm
Exactly.
not with you 24/7. Even when you go to the bathroom, I'm not with you. There
Exactly.
might be somebody
Right.
waiting for you in the stall in the public
Mhm.
bathroom. I don't know.
Right.
So uh,
True.
it's my job to protect myself. And so that's why I try to tell everybody, you may think you're in a monogamous relationship, and you may be in a monogamous relationship, but it's not going to hurt you to get tested either.
Right.
You should not have to worry about it. And it should be such an easy step
Yeah.
if you truly are confident that your
Right.
relationship is monogamous, that you straight and the person is straight.
Yeah.
Right.
I just tell them like, and then it's gonna be fine. If you're monogamous, it's even better. That means you're gonna
Right.
get a negative result. Let's just
Exactly.
say.
Exactly.
Let's
My
just say.
favorite though is when they're so monogamous and they come back positive for everything. I'm like, oh well, look at that.
Right.
I
Right.
always tell my
Wow.
children and my patients, if you know better, you do better. And
Yes.
if you don't do better, it's because you don't care. So now that we're here with this positive result, what are we going to do since we know better?
What are
Right.
we going to
We're
do?
going to treat it. You're going to abstain from sex until we get a negative test, right? And they're like, maybe.
But see
I'm
how
like, well,
many
if you're going to
times.
go mess around, here's some condoms
Right.
because
Thank you.
I can't trust you when you walk out of this office,
Thank
right?
you.
Listen,
And
I'm
that's
doing
how
my
it
best to
spreads
save you.
too. That's how it's
Right.
spreading because let's say the person is in a supposedly monogamous relationship.
Hmm.
They mess around with somebody else, they catch something, but even instead of coming clean,
Right.
they are afraid that the person's going to be mad at them for cheating, but they're
Yes.
not thinking like, oh, they're probably going to be even more mad if I give them something.
Yeah.
So maybe I should come clean and get tested
Exactly.
at the same time.
And you know what I think, no one's watching statistical data, right? Like
No,
I'm watching
exactly.
it, but like the
Right.
public is not watching it
Not
unless
looking
it's
at
like
that.
a
True.
clickbait something.
Right.
Mhm.
But I think that women, I'm gonna single out women.
Yeah.
Right.
I think that women, cisgender, transgender, however you identify, what I
Right.
think we're missing is that the current statistical data, when
Hmm.
we look at HIV, they're the population that is getting the most new HIV diagnoses are
Hmm.
women.
Yes.
Really?
Women,
Yep.
not men who's having sex with men, right?
Yeah.
Right.
They're more prep.
Women.
They're getting tested. Okay.
Right.
They're like the most tested population.
Right.
It's women who are cisgender women, heterosexual women. We're the ones who you see an uptake in new HIV diagnoses.
Exactly.
And why do you think that?
I think it's a couple of things. I think we're not empowering, right? From my standpoint, I feel like
Right.
people aren't empowered to get tested, or they're afraid to ask for testing.
Mm-hmm. Yep.
I think it's almost like cliche to demand that people get STI testing. I think it's an act of self-love to say, okay, you want to have intercourse with me? Well, I'm going to get tested. You should get tested too.
Right.
No offense to you, but I want to make sure I'm
I want to know. I'm going to tell you what I bring to the table.
yeah,
Right.
right. I want to be transparent with you because I respect you. There's always a way to word it so that someone.
Right.
So I think it's that. I think that people are leaning into sexual freedom more, right? There's not this scary closeted like, ooh, the people are more open. At least in New York, at least in the boroughs, you know.
The people that I associate with are too.
Yeah. People are more open and like willing to talk and try different things. I find compared to like the 90s and the 80s where everything is like, shh, don't talk about it. I feel like now people are more open and trying different things. So I think it's a couple of things that are like playing into the fact that there's a climb. But I think the number one thing is the fact that there's this impression that, oh, I can't get it. It's only men who have sex with men. I'm safe.
Right. And that's why I find that we need to push more on PrEP for people. PrEP is for everybody. Make that very clear. I know that the PrEP commercials, and trust me, my plan is to sit down with the big HIV pharmaceutical companies and let them know y'all need to change this marketing because the PrEP commercials are only really showing flamboyant gay men.
Yeah.
And I feel like it's kind of like dissuading cis het folks from getting PrEP because they're like, well, I don't look like this person.
Yep.
And I'm like, no,
even the brochure,
even the brochures, everything. When I'm handing out business cards, it literally has like a very flamboyant. We love our flamboyant gay men. I'm just saying, it's not just for y'all, okay? It's not just for y'all. PrEP is for all of us. And so people tend to see the imaging and get distracted by that and say, I don't need it. But that's why, I'm one of those people. We at dinner, I'm going to bring up some sex topics because y'all all fucking. So let's just talk about it. Like,
exactly.
HIV, you know?
I've had several people when I talk about PrEP, me being on PrEP, they look at me like, why? I'm like, because I'm having sex. That's why. And but they think the first thing they think of, oh, you must be fucking everything that moves. That's why you are PrEP. And I'm like, I don't care what you think. You can think whatever you want. That's
and
not
even if you are, at least you're being safe.
Yeah,
exactly. I won't be the one coming and crying that somebody gave me.
Yeah, and I think it's an opportunity. Like again, people are just. I'm a glass half full kind of gal. So I'm going to assume that people genuinely just don't know. You just don't know about PrEP, and you just assume that because I'm on it, I must be promiscuous.
Exactly.
I think that we can use the opportunity to give you a little education. No, I'm not promiscuous. I just want to make sure I'm protected. I'm having sex, and as long as I'm having sex, I am at risk for HIV. Period.
Exactly. Period.
Yeah.
So what? Go ahead, Masanya.
I was just saying it's my ultimate goal to get some of the, regular PCP providers more HIV and AIDS aware. Because I've had patients come to me and say like, oh, I went to my PCP and I asked them for PrEP and they told me, oh no, that's for promiscuous people. I'm like, oh no, come to the front of the congregation, provider.
Wow.
Let me have a seat with you. We're going to have a little lunch. And we're going to talk about why you cannot do that and the steps you need to take. Like, I really feel like that's my position in this world.
So it's not even just the general population. It's the doctors, the providers are not educated either.
No, they're not. They're not.
Wow.
And I think, and I can tell you from, a nurse practitioner standpoint, right? Like a provider standpoint, I cannot clearly recall anybody in my education journey spending ample amount of time on sexual education, how to have the conversation about sex, how to have the conversation about, prevention. I don't think I've ever heard of HIV prevention in a school setting. I learned it outside.
Exactly.
Wow.
In the world. Me too. Yep.
Yeah.
That's so funny you mentioned that because I feel like I remember the whole textbook, even though it was like 15, 16 years ago, and I don't recall anything. Like it was a very small chapter.
Thank you.
Like a little piece, and they put it, they grouped it under under like the hematological conditions, so blood conditions, and they're like, oh yeah, by the way, HIV, but we're not going to talk about that, and they go past
Yeah,
it.
it's like
It's
a
like,
very brief conversation. I can tell
yeah,
you, like,
yep,
it's like, this is what HIV is,
that's it.
CD4 count,
That's,
viral load. If it
yep,
goes between here, AIDS. Okay,
that's it. Yep. Once they have AIDS, they're gone. Next
that's
topic.
it.
Like, no, 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 no. There's
Right.
more
Opportunistic
to this.
infections next.
Hmm. And that's
You know what
because of
I'm
the
saying?
stigma.
That's the most of it. There's
Yeah.
not much time spent on like, oh, there's new, management therapies,
Right.
there's prevention mechanism. And
Right.
so, Masanya mentioned earlier her mission statement. My mission statement as an educator is to
Right.
like talk about PrEP in school. Like you should be learning in
Yes.
the healthcare sector. You should be learning
Absolutely.
about that in school, not in today's day and age when we literally have the technology, the
Exactly.
science, and the
Yes.
power to eradicate HIV. And the only
Literally.
reason we're not doing it is because providers, healthcare individuals are just don't know.
They just don't know. They
I feel
just,
like that's a whole other conversation in itself
I'm
because you
telling
could go
you.
deep into the whole um, pharmaceutical
Right.
business about it,
Yes, for sure.
because why wouldn't we want to reduce or eliminate that, nuisance that we have
Mhm.
when we know for sure we can?
Right.
So,
We absolutely can.
yeah.
No one has to get HIV ever again.
Literally,
We could
not in
literally stop it
2025,
today.
No,
Exactly. We could stop
and
it
not in
today.
the United States. I want to be very clear.
Exactly. Right.
Not
exactly.
in the United States. We have I don't know where the billions of dollars are going, but we got it.
Right.
And
We
they're
have to
spending a
resource.
whole bunch in
It's going
healthcare.
somewhere.
Okay, there's no reason. The medication, yes, it's expensive, but there are
Yep.
so many patient assistant things to get it like virtually free.
Mhm.
Even
Yeah.
the copay, there's assistant programs to cover the copay. Like there's literally not if you don't have insurance, at least in New York. In New
Mhm.
York, if you don't have insurance, there's programs to get your entire visit and the medication covered for free. Like there's
In
literally,
Georgia too.
Same
you
day
see?
too.
So, like there's
Yep.
literally no reason why
Yep.
Yeah.
if
Same
you
day too.
shouldn't be on PrEP.
Exactly. We
Thank
could
you.
save the world. We just need the world to listen.
That's true.
Yes.
That part.
Yep. Mhm.
We need the people who are in position
Mhm.
to speak up as well, like you guys, because people listen to doctors, anybody in the medical field, right? If I go and tell somebody, oh, you should get on PrEP, they just look at me like whatever. But if you, as a practitioner, say something, even if they're not necessarily going to do it right away, they may pause for a
Think
second.
about it. Yeah.
Yeah.
Right.
Exactly.
So, but those people, they need to talk about it as well to get everybody's attention because you have a pool that I don't have as a regular person.
Right. Well,
So,
definitely for sure. Like when there's protests in the city regarding, anti-HIV treatment and anti-funding for
Mm,
that, a lot of us do pull up. And I think it does, we write to the different campaigns and different administrations. So there's work being done, and that's why they can't completely eradicate what
correct.
work has been done so far. So I'm grateful for that much, but it's going to take a lot more work and definitely a lot of marketing changes to
yeah,
kind of pull in everyone. You know what I
everyone,
mean?
Yeah.
included,
I think
including
they're trying to now though, because I seen something on
Mhm.
Instagram,
Mhm.
when I'm late night strolling into the
Yes.
abyss.
Right.
I
the rabbit
seen,
hole.
yeah, but I'm down
Mhm.
the rabbit hole. I
Yeah.
seen that a couple of the celebrities were
Mhm.
like promoting and like I don't want to use the word promoting, but kind of like trying to educate their audience on
Okay.
medication. Yeah, yeah.
That's good. Glad.
That's good
Oh
to
my
know.
God, what is her name? I saw a video with Tamar Braxton talking
Oh,
about
yeah.
y'all better get on PrEP. You think
Mhm.
you safe out here? You out here having sex? Is
Right.
PrEP is for you too, ladies? So like I
Right.
seen a couple of celebrities like
Okay.
talking about it, trying to get the women on board. Like,
Yeah,
hey,
they really need to. They
yeah,
really need to. Like, that's pretty much what I do. Like, I go to churches. I mean, the churches, they ain't trying to hear all of this, but I come there and spread the filth
I
and let them
respect
know
you
what's going
so
on.
much, Crystal.
I really do, because, like, I mean, at the end of the day, I am a licensed minister, so I pull up with the licensed minister badge, and
oh,
I'm
you
like,
hit him in the head like boom.
girl, and then
You said
I
what?
surprise them. I'm
Boom.
like, I did not come here just for blood pressures. I came to talk about y'all fucking surprise.
She's like peekaboo.
That's how
Here
I
I
get
am.
them. That's
I
how
know
I
y'all
get
in
them.
here having sex.
Yep. Here's some condoms. Y'all can pretend if y'all want to, but I got y'all.
I seen this baby. How you think this baby got here?
Hello. Okay, you got about 10 of them. Like, what's going on? So that's kind of like my little devious trick to get in, but
I love
it,
it
works.
That's a great strategy because it's very hard to get inside some churches.
They're very rigid. I have a little edgy look to me, so they're all like, is she really a woman of the cloth? I'm like,
yeah, like, are you sure you are minister?
Exactly. I'm a little too colorful. Exactly.
Yes. So, what does a full sexual panel include, and what is missing from the current ones?
So a full sexual panel includes, and I'm gonna get a sprinkle big graphic.
Oh,
maybe
yeah,
for some people. Maybe for some people.
That's fine. You're in the right place.
Okay, maybe there's some tweets in the chats.
Yeah.
It consists of gonorrhea, chlamydia, syphilis, HIV, hepatitis B, and hepatitis C. Herpes is not a standard, but if you ask for it, we can do it. People are always asking, like, well, why isn't herpes a standard? Because everybody, like, 1 in 2 people have herpes. The person you look next to probably has herpes. Like, it's so frequent and so common, number one. And then number two, once you have herpes, like, what we do is manage symptoms. So there's really nothing that we use to, like, cure it. Like, we can cure gonorrhea, like, with antibiotics and things like that, but once you have herpes, it's like, you don't have an outbreak? Okay, well, let me give you some education so that you don't spread it. But standard panel is syphilis, gonorrhea, chlamydia. Here's where the graphic comes in. So most places, and this is why I need people to advocate for themselves, I want you to ask for what you want. If you're using your hole, any hole, the hole on the both holes on the bottoms, everything should be swabbed. So when you leave a urine specimen for gonorrhea, chlamydia, it's literally just checking your urine hole, right? So, like, but if you're having oral sex, it's not going to pick up oral sex. If you're having rectal sex, it's not going to pick up rectal sex. So you need to swab the back of your throat, and you need to swab the rectal area to check to see if you have gonorrhea and chlamydia there, because you can be negative in a urine specimen, but you could have it in your throat, and you don't know. You think it's like your throat or something. It's not.
Do you hear that, people? Do you hear that, church?
Listening, honey.
Okay. Get it swabbed. Get it all the way back there, because you can take some stuff back there. So come on.
You got a little sore throat and you've been a lady of the night, then go get swabbed.
That sore throat is not pharyngitis, honey.
Okay, thank you. A lady, a man, a them, a they of the night, a day. Go ahead and get swabbed.
Yes. So I always hear it in like that they don't like to do the herpes testing and the regular testing. And you know what? A lot of people don't even know about that, right? Because they'll come and be like, oh, I got tested. And then you ask, hey, did you get herpes? And they're like, well, it should be on there. I got everything. And then you look, it's like, it's not on there. So but they also didn't know. And I have somebody that went to get tested. And I said, ask specifically. And they did. But do you know they still didn't do the testing for them? When they got their result, it was nowhere to be found.
And then what happened?
Well, he ended up having to go back and get it done.
Did he have did the person have a conversation with the provider to feel like, why didn't you do it?
What happened? It's always the same thing. Like, oh, so many people have it. They don't test for it because people, when they find out that they have it, they go into depression and right. So
no, but I asked you.
Right.
I have a public service announcement. All right, and this is from a provider. Okay? Right. If you go and you see a provider, I want you to know, first of all, that no one's in charge of you. You have the right as a patient to say, yes, I want to do this. No, I don't want to do this.
Absolutely.
I want to go on medication. I don't want to go on medication. As long as we give you the information, the risk, the benefits, blah, 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 you are entitled to say yes or no. Right. If you go to a provider, I don't care who it is, the doctor, the DO, the chiropractor, the holistic, the MP, the PA, whoever, and you tell them that you want something done and they don't do it, they give you a nasty response, they make you feel uncomfortable. In these here United States, pain your provider. It is your
Exactly.
right.
Exactly.
You
And you
want to
know
be
what,
with
too?
people who makes you feel comfortable.
I always tell folks, make the provider document why they're not giving you.
That,
And
Oh,
you know they're not going to want to. So they're going to give you what you need. And
yeah.
I hate to
that's
be that person, but it's only because I know from the back end how things run. Document why you're not going to give me what I just requested. Yep.
You hear
Yeah.
that, people? Lots of good information, lots of gold here tonight. Listen, if your doctor says they're not going to do something, they need you. You should ask them. You
Yep.
must ask
Ask.
why they don't want it. They need to document
Yeah.
Mm-hmm.
why they don't want to do it.
And if you don't like their why, you go online and you Google
Oh,
and find
yeah.
you another provider, or call your
Exactly.
insurance company and find you another provider.
Yep.
I love that. A lot of good information. Thank you so much, ladies.
Mm-hmm.
We want to say thank you to everybody who's in the comments. We see you. We see
Yes, I see
you.
everything. It's so cool.
I
I
know the
just figured
comments
out
are
how to get to the
busy.
comments.
It's busy.
Yes, yes.
Yes.
So what groups are still disproportionately impacted by AIDS and HIV? I mean, I know you said a lot. You see a rise in monogamous women.
Mhm.
Um, so can you elaborate on that a little bit more?
Are you
Why do you
speaking?
think?
Are you asking specifically race?
Well,
Right.
we can go deep in there too. We like the
Because I
tea.
know who it
We like
is,
the tea, Dr.
but
Chanel.
I can tell you who it
us.
is because the CDC statistical data just came
Mhm.
out, I think earlier this year, if I'm not mistaken. Unfortunately, it breaks my heart every time I hear something
Mhm.
like, oh, African people of color.
Yep. All
Uh,
this.
so people of color are
Yes.
the ones who are disproportionately affected by HIV.
Yep.
It's us.
It
We
is.
don't even prep usage,
Yep.
our white counterparts, they're on the prep. They're
Yep.
on prep, they're getting tested, they're not
Mhm.
getting HIV, they're not transmitting HIV if they do have it. It's African Americans,
Yep.
it's Latinos,
Hmm.
it's a little sprinkle of the Asian Native American population, but most of it is African Americans or Black persons and Latino or people of Hispanic descent.
Right.
Why do you think there's a pushback? Is it us that's pushing back and don't want it, or they're just not paying attention to us when we're asking?
I think it's a combination of things. I think it's a rainbow soup of things. I think it's access to providers.
Yep.
It's the trust. Let's start with trust.
Right.
I know as a Black woman, that we just don't trust medicine. We don't trust healthcare at all. And honestly, we have valid reasons not to. More and
Hmm.
more evidence comes out that tells us why we shouldn't. So I think we don't have access to providers. We don't trust healthcare. And that's totally understandable. I get it. And we just don't know.
Right.
That's what I think it is. We don't know that there's a prep, right? You said you just learned about prep, recently over the past few years, but there are still people out here that I speak to that are, friends of mine that I'm like, oh yeah, did you know? And they're like, what? There's
Yeah.
medication to prevent prep, to prevent HIV?
Yep.
People just
Yeah.
don't know.
And
There's
there's
also not providers. Like there's not a lot of
Mhm.
providers who know and like are competent and like aware of how to administer prep, how to,
Yep.
provide for prep. They're not ready. We have a shortage in that department of
It's
providers who
really-
are like in the sexual health space.
Yep.
Hmm.
Exactly. Another misconception I find is people tend to believe that them taking PrEP means that they're taking a derivative of HIV to prevent HIV. I'm like, y'all are thinking
You
flu
heard
shot. Yes, yes. I have had a few men argue me down on the internet, okay, about this. That
it's the
yes,
bots.
it's
It's
a
not men,
derivative
it's the
of
bots.
HIV. And I'm like, it's
It
not a
gotta be.
derivative of HIV. Why are y'all thinking vaccine wise? This is not the flu shot. It's not the same thing. And so some people don't want to get on PrEP for that reason too.
What?
Hmm.
Yes,
I
yes.
did not know. See, I learned something new today. I did
Mhm.
not know that.
Yeah.
But yeah,
So,
like you said, a lot of people don't know because again, I
mhm,
met Lasagna last year, and that's when I
mhm,
found out about PrEP.
See?
In my, I was what 43 years old when I found out about PrEP.
right,
So it is really sad because they don't have those conversations
right.
um, So I am very grateful. I don't even remember how we met, but that's another time.
Right.
But I am so grateful that we met and
Me
boom,
too.
we started talking, and it's like, do you want to come on my show?
Yeah.
And everybody loved the couple of times that you and Travis were here because it was so much information, and they kept asking for more episodes. But
Yes. Of
so
Well,
this
this.
Latanya, why you didn't tell me? Travis is my business partner. He's our
Right.
co-founder at Temple
yes,
House.
she told me.
I thought you saw it, but you see, I did tell you this time. No, I tagged you.
You
Yes,
did,
I
you
did.
did, you did, you did,
Yeah, because I wasn't.
you
Some
did.
people don't really like doing the internet thing.
Latanya, you come and get me. I'm here for the people.
I
All
know
yes,
right.
you are. I know you
You
are.
know, you know. I'm not gonna go
But
into any like details or too
right,
much, in terms of
yeah,
like how we got to owning our own practice. But
right,
it's because
exactly,
we care about the people.
exactly.
yes,
So
All
yes.
right.
I met Dr. Chanel through Dr. Travis.
Okay,
Yeah, Dr. Travis is my ride or die. He
I
makes sure
know.
I'm alive. So, that's my person. He's like, yo, you good? I'm like, I'm good. You good? Like we're cool like that. So that's how I met Dr. Chanel and Dr. Brittany. So that's my crew. I love them.
So
Yeah.
So
maybe next time we'll have all of you in here.
that would be great. That would be great.
Yes, because
We'll really have a party then.
yes, 'cause like I
Exactly.
said, we love to talk sex, but we also want to talk about sexual health
Yes,
because
for sure.
as much as we are doing it, we need to know how to, what not to, and all the good things.
Right.
So, I would like to know, do you guys see fear or shame more in your patients that are infected?
Oh
And how
man.
do you navigate that?
Ooh, that's
Such a good question.
I'd say fear. It's fear because like I said, I worked in psych for a long time, but I noticed that when my newly diagnosed HIV, when I have to break the news to someone that they have HIV or they just got the news from the doctor and they're now meeting with me for blood work or whatever the situation is, I have had multiple patients say to me, if I did not come and meet you after seeing the doctor, and because the doctor does it, and, you're gonna be okay. Don't worry about it. Let me send you to the nurse manager. They be like, girl, I need you to talk to this person because they sound like they about to lose it. And they literally have said to me, like, if I didn't speak to you today to know that there was hope, I was gonna go home and kill myself. And I'm like, that sounds like a lot of fear. It's not even shame. It's literal fear that, oh, I'm gonna die anyway. I might as well kill. Like,
I might
no.
as well go ahead and do it.
I tell them like, you might outlive me, honey, because this hypertension been kicking my ass. But you got hope. At least you can keep your viral load down. My
Right.
hypertension is out of control
You
over
know
here.
what?
I give them so much hope. They're like,
You
oh my
are a
god.
mess.
But yeah, I mean, I get it. I know just a handful of people
Right.
who are infected and were comfortable sharing that with me.
Mm-hmm.
And I truly appreciate it because, like you say, fear is shame. Now, obviously, the people who have lived with it for a long time, they don't have the fear anymore because at this point they are educated in their bodies because some of them have had it over like several decades, but it's more now the shame because you are no good anymore, right? So you can only date in your community or you can only date people who are infected because sometimes I see people online just trolling like,
Lies.
oh, I know. Like just
What?
telling, oh, so why are you trying to date if you infected? And it's like,
Right.
oh, does that mean I'm
I have so
walking
many
or
patients that are married, they're
They
dating,
don't
and they
know.
are with
I'm gonna
people that
reiterate.
have
They must not
yeah,
know. They must not know.
they don't know. I have a lot of
Trust
patients that
believe
are married to
that they
people
don't
that
know.
have HIV and they're negative.
right?
And their partner is positive, and they both, one is on PrEP, one is on HIV treatment. They've been married for 25 years.
I know
Like,
people like that.
yeah. And they're
Yeah,
doing well.
Making babies, unprotected sex. They're
Exactly.
having a good, fabulous life,
Yep.
having a good time.
Exactly. They're having kids as well. Yep.
They have
It's so
yeah,
kids.
yeah. I came across this young girl on my feed that just admitted. Well, she didn't just admit it. I guess she just started blogging about it. Um, because she got infected. In the first 3 months, she was untreated because she didn't know what was happening. She lost
Mm-hmm.
20 pounds in 1 month, didn't know why. So finally, she made it to the doctor, and they broke the news to her. And at first, she was very distraught, but now, you should see her healthy, and it's amazing. She's had a lot of support online, but a lot of people are also just like, oh, you no good, trash, and
Mm-hmm.
whatever. So there's a lot more people coming out and talking about it. There's this lady, she was pregnant with her baby while she has HIV, but her husband doesn't have HIV. I mean, it's so nice to see those encouraging stories online to let people know, hey, it's not the end of the line just because you are
It's
infected.
not. HIV moms can give birth to HIV negative babies in
Absolutely.
2025,
Yes.
which
Yep.
is beautiful. It's such a beautiful thing to see because a couple of decades ago, it was literally a death sentence. We've come a long, long, long way.
We've definitely come a long way.
Yeah.
So I like that.
Absolutely.
So how can people talk about testing with new partners without killing the vibe? Because people get kind of turned off if you mention testing. How can they bring it up without killing the vibe?
I say make it the first date. I don't know if that's too forward. I mean, I feel like people move really fast in relationships anyway. I say make it
Right?
a first date thing. Go in the morning, get some blood work done, and go do breakfast after. You know what I mean?
Okay.
Yeah,
Yeah.
I don't think that'll hurt. And if you're not talking about sexual health with a person that you plan on having sex with, you shouldn't be having sex.
Right?
That's all I know.
Boundaries.
Yeah, there
Yeah.
has to be. You gotta be an adult. You know what I mean? With this thing, you're consenting to sex. You need to consent to sexual health as well.
I
Exactly.
also think like you, I would hope that you at least care about yourself more than you care about what other people think.
Right.
Exactly.
Like,
If
don't you
you
want to make
even
sure
raise,
that you're good?
Right. You know.
Don't you
if
want to protect
you even
yourself?
if
Right.
you even raise your eyebrows, I'm out. Somebody just said that's hella forward. I don't think it is at all because honestly, sometimes I talk about testing before we
Right.
meet the first time because I'm not about to waste my time with you if you the kind of person who has that kind of thinking.
Yeah,
Right.
yeah,
I,
that
I
part.
talk about it. I mean, we talk about it really fast. We talk about
Right.
sex. We talk about what we want, what we don't want, all those things because like I said, I do not want to waste my time or your time.
Yeah,
If we're not in alignment, then
Yeah.
let's keep it moving. No, no, no foul in that.
One
So
of the comments, Mark L said that he actually got tested for a first date one time, and it was pretty cool. I
yeah,
think it works. I don't
thank
know.
you,
I
Mark.
personally,
I
Thank
think
you.
it's a flex, right?
yeah, I think it's a flex. It really is. I think people should try it.
It just, I feel like it shows like I care about me, but like I care about
Right.
you.
And
Exactly.
you know what?
And I'm really doing it for you.
I
Right.
would fall in love so fast.
Yeah, I think it's
And,
cool.
I'd be like,
Mhm.
okay, you can have whatever you
You
like.
know,
It's
and I,
yours.
Right.
you know what, I think I kind of agree with you on that because it always like in the
Mhm.
back of my head, I remember when I was younger, when
Mhm.
like guys would try to like just jump my bones and I just met them and I'm like, wait a minute, are you doing this for everybody? Like, hold on,
Right,
sir. Wait a minute. Hold
right,
on. Hold, you didn't even ask me for nothing. You're not even getting a condom. Like, are you doing this for everybody?
nothing,
I don't
nothing.
want you. So like it's such a turn off, like you said, when someone's like, oh no, why do I need that? Sir,
We're
ma'am,
not even gonna talk at this point.
thank you for the date.
Yeah.
Okay.
Exactly.
And another thing that women get shamed for is carrying condoms with them.
Oh yeah.
Not women condoms, regular condoms.
Yes, the
So
regular
it's
male.
like,
What?
oh yeah, so
Yes.
you have condoms on the way.
Yes.
Yes,
Hmm.
everywhere I go. The same way that when I transport my purse, the condoms get transported.
Exactly.
They get
I
moved
think
to
that's so important.
Yeah. You know what it is? We just have to learn the way of like saying it so that
Mhm.
it doesn't give off this perception to the people who have these perceptions in their head. Like,
Right.
oh, so you just out here? No, I just want to make sure I'm prepared because when you and I are ready,
right.
just
Exactly.
in case you forgot it in the car, I got you,
Exactly.
babe.
It's a lot of unlearning of
Yeah. Yeah.
antiquated ideologies that, men should carry the condoms and the woman should be a lady and just lay back and he'll put on the like, listen, you better take control of your sexual
Honey,
health.
you better look. You better pull the glasses down.
You
They
better
got it
make
on?
sure. Okay.
Let's make sure it's on there.
All right?
Exactly.
Is it
That
on?
part.
All right. And if you don't want to do that,
Alcohol.
if you don't want to do none of that, get on
Yeah,
prep.
exactly.
Get on the prep.
That's
Exactly.
it.
Somebody
That's it.
said, I'm not going to get tested with someone asking for results is different to me. I mean, I guess it depends on your preference, you
That's true.
know. Some people will like it, some people don't. I would like for you to have the results ready just in case
Right.
you get heated up so we don't have to like
Because it depends too, how old are the results? If you got those
right,
results 2 months ago and you and I are going to be intimate today,
I want new
how
results.
many people have you had sex with in
I
that?
want new.
in
It don't
between.
matter. You could tell me 0. I want new
Exactly. Every
results.
single time you have sex, the results invalidate. And that's what
I
a lot
want
of
it.
people don't realize.
Yeah,
Right.
Yeah. So you need to get new results. So
that's right. Go in that portal, pull it up. I need to see the date. I don't want no
exactly.
copy of the date look a little sketchy. Pull it up on the
Exactly.
portal. Okay.
Mr. Sleepy Brown, we're going to get new test results. Sorry to break it to you.
No, but I feel like maybe I'm misinterpreting what CP Brown's saying, but it looks
Maybe.
like they're saying like they don't want to go get tested with someone.
Yes.
Oh,
Which
I
is fine.
see.
Like you don't have to go on a date. Like that's cute if someone wants to go on a date together and get tested, but you don't have to do that either. You can go get your own testing in your
Exactly.
own
Oh, absolutely.
private, you know,
So
take care
make
of your own
sure, make
private
sure
business.
you
Yeah.
actually are going to get the testing
That's
and
the part.
it's not nothing fraudulent because I've seen people, which is just absolutely ridiculous. I'm laughing
Dr.
already.
Masanya, please no, don't tell
You
me.
know,
Please
I'm
tell
gonna take
me.
it there. You know, I'm gonna take it there. The fraudulent test results with the
Oh,
name
Lord.
John Smith, and they're sending it out as, "Oh yeah, I got tested," and they're not even checking to see that this
Uh,
Smith. It's a
block
junk.
them.
Wow.
Block them.
Block them instantly.
It's not
Okay?
safe. Block them.
Exactly.
This
Markel
is
said,
bad.
if you stay ready, you don't have to get ready.
Come on, Mark. Mark is on the come on.
Okay.
Mark knows the deal. So, you know, a lot of times we hear men say that condom like kind of takes away their erection,
Right.
or they feel less, or
Right.
they just can't stay hard when they have a condom on. So that's why they prefer it without a condom.
Right.
So what do you think those men can do practically to stay comfortable, confident, and fully engaged while still using a condom?
Try different condoms. There's so many different types of condoms. There's the thinner ones. They have some that are so thin that you can. It feels like it's next to skin. They have some new ones that I just found out about called Lilo, and they have honeycomb patches like all over it. So what if it does pop? Only one part of the honeycomb pops, not the entire condom. It's nice and thin from what I heard.
Okay.
There's different options. Try as many different
Try.
condoms as you
I
want.
agree.
Yep.
I agree.
Mhm.
That is great, great information.
So,
So
yeah.
I don't know if the audience, somebody says lifestyle skin not is the best.
That's
Okay.
what I heard. That's what we have
I've
at our
heard that
food
too.
chain. That's what we have. We
Yes.
have lifestyles. Okay.
Okay, so I always feel like the lifestyle is so small because they
Mhm.
always offer it for free when I go, and I'm just like, but it looks so small. So what are
What
the
size?
men supposed to do?
They got the wrong size at wherever you get it for free. You need a different size.
Right.
Mm,
Yeah. Because I feel like, a lot of times people say that condoms are small, but you can put your whole hand in it. And I think that should be sufficient enough. Like, you can put your foot in a condom, an average size condom. I've done it. I'm about to get one so I can
You
show
know
y'all.
what?
I've done it.
You know what?
Check it
That would be
out.
good. That would be actually a
Yeah.
good show.
Right. Yep. I've
we
done
should
it.
have demonstration, right?
I
Thank
know. I
you.
wish
I like
I,
it.
I have condoms all over the house. I just gotta find one.
Oh, I have them everywhere. So I remember I was having a conversation with my
Hmm.
then 14-year-old, and
Right.
we were talking sexual health, sexual
Hmm.
everything. And so we got to the condom part, you know, 'cause,
Give me
you
that.
know, you got to learn how to use it, how to put it on properly, what
Right.
it looks like, what it feels like. So I go and grab one and bring it, open
Hmm.
it. He's like, wait, I thought you said those are for the men to use.
Right.
I said, yes, it goes on the men's part, but
Hmm.
it's both of us using it. But also, I'm always prepared. I always have them with me because if we are in the middle of a something and then now he doesn't have one, I don't have one, then we can't continue. So that's why I always have it, because I'm responsible for myself. I don't worry about what he has, what he doesn't have. I worry about what I carry with me, and I always carry those. He's like, oh, but I had some female condoms as well that I showed to him, what it looks like and everything. He's like, oh, okay then.
That's good.
Yeah.
That's what should be happening.
I never had that talk. They just told me not to
I
go
didn't either.
play with boys, and that's it.
No. That's the same talk I had. Don't have sex, don't make any babies, don't bring any babies home. That's the end of the sex health talk at my house.
Listen, I heard that talk, and I got a grandchild, so I don't think my child was listening. My grandchild's my best friend. She's right here. She's putting stickers on the floor.
I think I learned most. I learned all of my sexual health younger in school.
Oh,
yeah. The Department of Health came in. They did a sex ed class. They scared us half to death with the video.
Oh my goodness, that's hilarious.
Yeah. By the time, I always tell people, this is how paranoid I was after watching that sex ed video. I wasn't even sexually active. I went to get tested, and I was still nervous. I was still having a panic attack. Oh my god, oh my god. So I get it.
Yo.
I get it.
Yeah.
I think you're still gonna get nervous every time I go get a mammogram.
I think so too.
Oh, what happened now? And it's like, no, it's fine. I'm like, okay, I think it's just in your mind. If you don't get tested, all of a sudden you get nervous and anxious about the results.
Right. So, that's true. I think that's normal. It's nerve-wracking.
I know you guys have been here for an hour. I
found a condom.
Oh, yes, please.
Wow.
I want to see you put your hand.
So I want to, because
you gotta tell us the size. You gotta tell us the size.
I got my nails on, so
what size is it?
Oh, this is
Me too wants to know the size. Is it a small one?
Vanish Hyper Finish. It says 2 hyper thin condoms. It doesn't say a size,
but it looks small.
It does look small though.
Let's see.
Yeah, I'm just so afraid I'll pop it because of my nails, but we want that. And so for every man that's like, oh, I'm packing, girl, I can't wear condoms. Just know that
with the nails.
Yeah.
The whole hand with the nails.
Yeah.
With the nails. Okay.
Okay.
I'm a tall girl. I'm 5'10".
Yes.
20. Okay. So I'm a big girl. I pop it with my nails. So my whole fist could fit in there. So don't let them tell you any bullshit.
Now you make me want to try the one, the free one that they give me.
This is one of the free ones.
Why condom sex but no condom head, male and female? Oh, you guys should answer that.
I mean, it's up to the person. But yeah, these are the free ones. I got this from a random clinic. I'm actually sending them down south because some folks down south and in the Midwest don't have access to these sexual health clinics, and they have them, but they are limited on their resources. So someone from the Midwest actually hit me up and was like, yo, I see that when you're doing all this outreach stuff, you're always giving out mad condoms.
Yeah.
Can I get some? I'm like, hell yeah, you can. I'm going to the post office to send them out tomorrow.
Okay,
that's they don't have
that makes sense. That's probably why they have that. That is exactly why they have such a high rate of HIV in those
absolutely
in the Midwest and southern states. Because of access.
Exactly.
Yeah.
Yep.
Just so that to go back to what the person asked, why condom sex but no condom head? We haven't talked about dental dam. A lot of people don't even know what that is, so maybe you guys should touch on that because that's probably why he's asking.
A dental dam is I think what I usually tell patients is it's a condom for the mouth.
Yeah.
Right? Because I remember I said earlier, although condom for head is not a commonly talked about thing, the way you get chlamydia and gonorrhea in the throat, is because so people should be having using dental dams and using condoms when they're giving oral sex.
Right.
Is it something that is commonly talked about or commonly promoted? No.
Right.
definitely not. And honestly, I've never used a dental dam. I do have a
Mhm.
few. I've opened them and looked at them, but have I ever used them? No.
Right. And it just goes back to being sex positive. Like,
Yeah.
I've had patients, which it was funny to me, but they've gone to Pride. They got their test results before they went to Pride. Everything was negative. They go to Pride. They're like, "Girl, I didn't even do nothing with nobody. I don't know why I got this chlamydia and gonorrhea in my throat right now." I'm like, "Well, did you kiss anyone?" And they're like, "I did kiss this one guy at the bar that I didn't know." I'm
There
You
you
like,
didn't do
go.
anything.
"Boom."
There you go. He
Let's get
probably
this
had a
sex
little.
tax on
He had a
popping.
little sore
Like,
throat that he thought was like, oh, I'm taking
exactly.
some antibiotics. It's just a little strap.
That's what they think, and it's not strep.
Hmm.
Right. So, let's talk about herpes. I know we're here for AIDS, but I think herpes is another one that everybody's afraid of just because there's
Mhm.
not a cure, but this treatment kind of thing.
Right.
Um, like you said, a lot of people have it and don't know. Why do you think some STIs show symptoms versus those that don't show any symptoms? And also, a lot of people always think of herpes as like a bunch of big warts on somebody's mouth or
Right.
genital. Like, can you guys talk about that?
Oh, yeah, absolutely. So herpes, I guess I'll start with herpes. It
Hmm.
does not have to be general warts and like a whole bunch of like sores. It could just be a blister.
Right.
It could be a blister. Sometimes it's outside on the lip, on the mouth. Sometimes it's inside. You don't even
Right.
know it's there. On
Mhm.
the other person. Same thing with sores in the genital areas. Like it could be like a really tiny little tiny thing. Like you won't even see it. If you're having uh, sexual intercourse in the dark, you're definitely not going to see it, and you won't even know.
Exactly. Yep.
Most people, only what they say is that most people who have herpes, when they're about to have an outbreak, they can sense.
Mhm. Yes.
And so they feel like it feels like maybe they don't know that that's what's happening, but what they usually feel is like a burning, tingling sensation before anything even shows up. There's like a burning, tingling sensation, and when you, as someone who has herpes, feel that, the what you should be doing is like abstaining from any kind of sexual intercourse, oral sex, anything like that, because now you're at risk for spreading it to somebody else.
Mhm.
Same thing with open sores. Like if you have open sores, then you can absolutely spread it to someone else. So I think that the misconception that people are walking around with like big boils and warts everywhere, sometimes you can't even see it. You don't
Right.
even know.
So I remember one time this person was literally talking mad shit about herpes, right? While this person has something on the lip, and I'm just looking at them like,
Really?
have you ever gotten tested for HSV1 or 2 or all of it? Like,
Hmm.
here you are just throwing shades,
Yeah.
but you don't even realize that you have it.
They don't know because someone probably told them it's a cold sore, and they're like, "Oh, it's not a big deal. It's just a cold
And
sore."
that's exactly what they said. It's
I
a
know.
cold sore. And I'm like,
They
okay,
don't know. See, I told you, you got to give them some grace. They just don't know.
They just
exactly.
know.
But
It's
also, they may know, but because of the stigma, they're so afraid now to
Oh,
say it out loud.
that's true.
And I've also talked to people who are like, oh, I would never sleep with somebody who has HSV1. Well, I'm saying
You probably already did. You
right,
probably already did. You just
HSV.
didn't know.
Yeah, it's just because a lot of people don't know this terminology, so we got to remind them. So that's herpes. They call it HSV1 and 2. Um, so and then I'm like, so what if you throw all this shade? Because at this point, you've never even gotten tested for it specifically. Then you go get tested and come back with it. How are you gonna be? Are you gonna be a better human? You're gonna be humble now because you know you have it, or are you gonna continue to be a jackass and pretend like you don't
I
have
don't
it?
have it. Yeah.
Because a lot
Yeah.
of people do that, and it's such a shame. And that's why so many, I mean, there's so many things that are on the down low, right? Men on the down low, um think STIs on the down low, and I'm like, but we don't make room for people to be comfortable
Yes.
talking about those things. So of course they're always going to be on the down low, because as soon as they open their mouths, you try to shame them,
Yes.
and you put them in a corner. Now they are no good, they're dirty, they just have the plague basically. So how are they supposed to talk about it? And they're always going to continue. That's why it spreads so much, because they can't talk about it.
Correct.
They don't want to be shamed, so they're going to act like they're just like everybody else.
Everybody else, nothing's wrong. I'm perfectly fine. Like, no.
That's it. So
yeah, I think it's like, it's the shame of having people judge you. And it's not like, this is not just this feeling that people have is unfortunately a natural feeling. And it's not specific to the sexual health space, right? Think about like when, even now, I think people still are like, oh, you got the Ozempic body, you didn't really lose the weight, you just been injecting it. And it's like a whole bunch of shame because you took medication. When has it ever been a bad thing to lose weight? I'm so confused.
Right.
You shame me because I was overweight.
Right.
You claim I was eating everything under the sun.
Exactly.
I tried to work out, it didn't work. Or I tried to eat healthy, it didn't work. Or I need a little bit more support, and now I'm doing the right thing to get better. And you're still upset.
right.
Exactly.
You still think I'm doing the wrong. Forget it. People are obsessed. People are obsessed.
Yeah,
you have to get to a point within yourself where you are comfortable with yourself and you're being honest with yourself. Because if you are saying and being and moving to please everybody else, you're gonna be miserable, because they ain't never gonna be happy.
Yeah. So I am. Yeah. I tend to not associate with people who are negative about sex and anything. I mean, typically you'll catch it real fast. You don't even have to be around that person a whole lot.
Yep.
You'll catch the drift, and I just keep it moving because I honestly don't have time, space, or the bandwidth for it. Let's keep it moving. We don't have
a lot of energy. Yeah.
Exactly.
So true.
Exactly. So, well, we are at 1:15. So I think we could put a stop to this. Maybe come back to this conversation, because I know we are working professionals.
Yes.
And a lot of people are in the comments and watching as well. But maybe we can come back for more, especially with Dr. Travis as well.
Right.
I'll get don't worry. Masanya and I will be on his case. Don't you worry. We'll get him.
All right.
And we'll pull Dr. Brittany next time.
We will. We'll get him here and really get it.
Yes.
Yep.
Thank you so much.
You can always follow us on social media.
Yes, please.
For Chanel, Travis, and Brittany, they are at _simple healthcare.
You see, this
literally
is
spelled that way. _simple healthcare on IG, and I am the Divine Comfy Couch on IG.
You see?
I love it.
Like, I don't even have to like open my mouth.
I got you guys.
She just knows.
She's got you, Dr. Chanel.
I love her. My God.
Yes. Too.
Yes. Well, thank you everybody who came to participate with us and
absolutely.
With us. Thank you, Crystal, Masanya. Oh, don't go. She's here.
Oh, no. I'm here. Yep. I'm here.
She's my so.
Yes.
Thank you so much, Dr. Chanel. I am so happy. I literally hit her up last minute because, I'm always kind of like, what are we going to talk about?
This was actually divine intervention because she posted something.
Yes,
and
I literally went under the post, like, we should do
that video is so
live. And she was like, oh, you should come on. And I'm like, yes, I'm coming.
Yes. I was scrolling through Facebook and I saw it. I was like,
that was a good video.
Oh my gosh, she needs to come back.
Glad.
I said, I'm going to send her a message. I know it's last minute, but I'm going to see if she wants to come in, if she has time with her. And she's like, I'm in, and I'm going to bring the memory with me. I was like,
exactly. I love it. It's God's work. We're saving lives.
She's always doing God's work.
All the time. And I that video I posted, that was like 2 years old.
Was it?
2023. Yeah, it's from 2023. And
this is good.
I just happened to record it and I left it in my phone. I was like, I think I could post this today. It's AIDS, it's AIDS week. Why not? And I posted it. So there's more of that in my phone that I gotta dig to find.
Send it over here. You're
I
not posting
know,
this thing over here. Let me
absolutely.
post it for you. Okay.
Absolutely. Thank you.
I'm so
Yes,
grateful
because
for that.
people need to know. Like I'm talking about penicillin and syphilis and all types of stuff. I love doing stuff like that. Yeah, I love
Yeah.
educating
Oh,
the
before
people.
we go, since you mentioned, uh,
Hmm.
I'm gonna say it with my French Creole
Hmm.
accent,
Hmm.
penicillin.
Yeah, penicillin.
Ah,
So funny.
Again, say it again.
Penicillin.
Penicillin.
Hmm.
Penicillin. I have to put the
Right. It's
pen-
okay.
phrase penicillin. So
Yeah.
I've heard people say it's a very painful shot. I know we said we were gonna go.
Oh yeah.
It's a very painful shot to get.
Yes, it is.
Can you tell them a little bit more about that?
Oh, so I this is my recommendation. I always say for the person giving it, let it chill off for a little bit. You do not have to
Okay.
give it cold straight out of the fridge. I wish people would stop that practice. You don't have to do that. I like to roll it between my hands for a little bit. I've told my patients, don't worry. I put it in my bra for a little bit. It's been nice and warm. Like, here you go. Boop, boop. Give them their injections and send them on their way. Also, another thing is I like to split the dose because one single dose is too much. So I split that one dose in two. So unfortunately, you do get two injections, but it's split so that it's less painful.
So what does that mean? You split it? Like, do they get it right then and there, or they have to come back for it?
Same day, same day.
it's just 2 shots instead of
It's
one.
two shots instead of one.
Yeah.
Yeah, but it's less. It's a very thick, creamy, cold liquid.
That's what I've
So
heard.
yeah, you have to. For me, I split it just for making it more comfortable for the patient.
Do you
So
mix yours with lidocaine?
So
what's
I've never mixed it with lidocaine because the one
Really?
it was already constituted and it was super.
Oh, okay.
That's why. But if I did have access to one where I had to constitute, I would do it with lidocaine.
Okay, because that's what I do. I mix it with lidocaine. Lidocaine is like
Yeah,
a medication for pain. And so
yeah.
instead of mixing it with like sterile water, I'll
Right.
mix it with lidocaine so that when
Always
the
use lidocaine.
injection goes in, it should also relieve pain while you're
Right.
getting antibiotics.
Right. Hmm.
okay? So is it the cold that makes it hurt? Because you say you try to warm it up,
Yeah,
or
I feel like it's the coldness and the fact that it's super, super, super thick, very viscous. It's going
Very
into
thick.
a muscle. That's one. It's going into the blood vein. The blood is flowing with this super thick, creamy liquid, so it's fighting against it. It definitely
Yeah,
hurts.
I think it's a combination of it being thick, like you said, the
Hmm.
volume. So if you do one, like usually I put like
Right.
2 mLs, 2 milliliters of
Right.
medicaine in
Yeah.
there. Like injecting 2 milliliters in somebody's butt cheek
It's a lot.
into a muscle is painful
Mhm.
as it is. So like I think it's the thickness and the amount, the length of the needle. Like it's just a
That
combination.
needle is huge. You could see into the hole
Don't
of
you
it.
scare the people in them.
I'm
Go
sorry,
get
y'all.
treated. Go get treated. All right.
Listen, I'm not
obviously if they
scared
have
y'all to
it
see
and they
y'all.
See
want to,
Miss Tanya. Come see me and Miss Tanya. We're gonna make sure we make it nice. So it's not too
Exactly.
painful.
Exactly. We'll give
so
you snacks.
so if they know they're gonna get that shot, could they go ahead and use a little bit of the lidocaine from over the counter in the spot,
Oh
or
yes, I do that too. Like a lidocaine spray.
yeah?
Yeah, that
Yeah, I
helps.
have that. I do that too.
I feel like take some Motrin or something before you come
You could
in.
do that. You could do
Yeah.
that. You could take
Yeah.
some Motrin, some Tylenol before you go. If you
Right.
forget, I my common practice. I have lidocaine spray, and I
Right.
just spray you up, and I mix it with lidocaine, and now you're like lidocained up, and
Definitely.
so you shouldn't have too much pain. You're still gonna
Right.
feel like a little sore because we are going into a large
I-
muscle, and it is really thick, but it shouldn't be
Right.
as painful.
Right.
Okay,
Yeah.
that's
Yep.
good to know.
And again, if you go somewhere, okay, and it's not
Mhm.
giving what it's supposed to give.
Right. Then get
We
away.
in these here United States, you go wherever you get best care,
Exactly.
okay?
Yep.
Running fast.
Yep. So true.
You go where you
Well,
get good care. You're not getting what it's supposed to get. You pass it up.
Exactly. Yep.
yes,
Run
yes.
for the hills and find you folks that know how to play ball. So I always say,
Yeah.
go with the people that know how to play ball. The sexual health professionals are the best people to go to when it comes to these things. HIV specialists, AIDS, HIV certified people that know how to play ball.
Are doing
Yep.
the
You don't
work.
want to
Yep.
go to the wrong people and they tell you, oh, you can't get on prep because you're a hoe. Like, no, I
Right.
can get on
So,
prep even if I'm not having sex. It's up
how
to
do
you.
you find those people?
So there's multiple ways. I would say call your insurance company. There's also Google, or you could just go to Simple Healthcare.
Period. Period. If you're in New York, period. Because we do
It's New York
telehealth.
based,
Period.
it's virtual.
Healthcare.com, right?
Yeah.
It's helloshc.com.
Yeah, helloshc.com.
Yeah.
Absolutely.
HC.com.
Yeah,
All
you
right.
get a bunch of virtual providers that look like, yep.
And I also put your Instagram handle in the comments for people to
Yeah.
follow you. And
Yeah.
from there, they'll find everybody.
Yes.
Yes, absolutely.
All
We're
right.
following each other. You'll see, like in our, what is this called? The link tree, all of our stuff.
Yes,
our stuff
exactly.
is there.
Okay.
Yep. I'm
The bio.
100% behind them because I'm like, I see the work that they're doing in the community, and I'm like, I like this.
Because
Yeah.
we genuinely, like, I've worked. Let me take this back. I've worked in larger organizations. Like, I've worked in other providers' office, and like, there's just like, how can I say? Maybe something's wrong with me. I just genuinely care about people's health.
Me too.
But I want to do things my way. I don't want you to feel rushed. I don't want you to feel like I don't care. I don't want you to feel like I'm just here trying to jab you up. I want to have a conversation. I want to empower you to be free, like no matter where you go, after you leave me, to advocate for yourself.
Exactly. Yeah, that's important to me, to take my time and discuss things. The patients need counseling, especially if they have HIV. They need counseling, especially if they're getting on PrEP, and maybe they're getting on PrEP because something happened to them, why they need to get on PrEP. I cannot rush a patient out in 15 minutes because insurance is only paying for 20 minutes when they are literally about to kill themselves. And I'm like, whoa. Let's take an extra 20 minutes.
I got to give a hug.
I had
a patient come in for PrEP.
My patients know they're going to get a hug. You know,
I had a patient come in for PrEP, and that poor man was so paranoid. First of all, he's living in secret inside his house because none of his family knows that he is a man who likes to have sex with men.
Right.
His mom is pressuring him about kids.
Yep.
And a girlfriend and a wife. And he's afraid of getting HIV. And so when he came in my office, he was a nervous, panic mess.
Yep.
He was literally in tears. There's no way I can see you in 10, 15 minutes, give you quality care, get you on PrEP, and then send you out. Like, no, I had to give the man a hug. I had to rub his back. Listen, you're going to be fine. You're going to be fine. You don't have to tell your family none of your business. You have a homeboy, you got a homegirl, you got a therapist. Talk to people that really want to make sure that your true self is good.
That part.
That's good. I mean, I do like that because I feel like my lady, she takes really good care of me. Like, I never feel rushed. She asks me a million questions. Do you have questions for me? And she explains everything. And like I said, when I was getting the injection, I felt like I was 3 years old. And she was okay treating me like a small child that I was, sitting on her table that day, you know. She was very patient. She waited and she's like, "Are you ready? We can take our time, or if you want to come back another day for this, that's fine too. If you don't feel ready." I'm like, no, I can do this today.
That's what you want.
Yeah, I mean,
that's what you want.
We were probably sitting there talking for at least 30 minutes about that part alone. That's after we've talked about the other stuff, go over the information and all that. And, you know, I left feeling so empowered and supported. I just loved it. She always takes the time with me. When I go for my appointment, I know I put aside 2 hours. It doesn't usually take 2 hours, but they take me back there right away. And the majority of the time is spent with her. And it's usually when I'm ready to go, basically.
Yeah. That's what you want. I wish that for everybody. It's difficult, you know, like I listen, it's all about the money, right? And so like it's difficult for larger organizations to do that because they're focused on like, how do we stay afloat? How do I pay my cars? How do I pay but if we can wave our Harry Potter wand, which is what I always say, if I had a magic switch, that is what you want. You want a provider like that.
Exactly. Yep. Everyone deserves it.
Yeah, everyone deserves a provider like that, and not just sexual health, like everything.
Everybody,
your cardiologist, your primary care, your GYN, everybody should have that experience.
Exactly.
That's why I stopped going to a primary care because I would be in the room 30 minutes naked and cold, and then they come in 5 minutes and then they're gone. It's like, I have questions. Where did you go?
It's time
So
to go on Google. Switch them.
exactly. I haven't been to one in a while, but I need to find me one. But it was mainly because of that, because it was a constant cycle. It was the same thing over and over. After a while, I was like, I'm just gonna see my gynecologist because you guys don't ever do anything for me anyway. So yeah,
Should not
but
be a thing.
yeah. Well, I know we can be here all night.
Oh
So
yeah. Sorry. It was so good, you know. Sorry.
Yes, it's always a pleasure to meet with you guys.
yes, thank you
Thank you
so
for
much.
Chanel for popping up. Listen,
Yes,
Thank you for inviting me.
of
I had
course,
a fabulous time.
yes,
yes.
me too. Thank you for coming. Well, we will come back after the new year because I know it's the holiday season.
Yeah.
Everybody's trying to. One thing people always ask me, "Are you ready for Christmas?" Yes, I've been ready since January 1st because I don't do anything because I don't do like all the gifting and all of that for Christmas. So it
Right.
takes that pressure away, and I'm so
Mm,
grateful for that because
Mhm.
I see people just running crazy,
Mhm.
needing to do certain things around this time of the year. So I know it's very stressful on everybody. So we will probably put a pause on the podcast after this episode and come back after the new year because everybody's busy for the holidays and they got to focus on their families and the babies, the grandbabies, the booze, all of that. So we say thank you to everybody. Merry Christmas, Happy Hanukkah, all of it. I don't know all the holidays. Um, excuse me. Happy holidays to everybody. Happy New Year. We will
Happy Kwanzaa.
back
Happy
after the New Year.
Kwanzaa.
Yes, Kwanzaa. Thank you. I knew I forgot something. I told you I don't know. I grew up and it was Christmas. So
Right.
and
Mhm.
I didn't know a lot about the other holidays until I came here. So um, thank you guys again. I can't thank you enough
Thank you for
for
Absolutely.
having
coming
us.
on tonight. It
Crystal.
was such great information, such great vibe. It's
Mhm.
always a vibe with
Always.
Crystal. So
Love you guys.
yes, love you too. So we will
Yeah,
see each other soon. You
for
guys have
sure.
a good night and see you after the new year.
Yes, absolutely.
Bye. Happy
Bye.
holidays.
God bless.